So for this question, we're looking at 6 major pairs of arterial pressure points in the body. So pressure points being areas that you would put pressure in order to stop an arterial bleed. So the key things is to remember that arteries, again, carry blood away from the heart. So when you're trying to stop an arterial bleed, you have to put pressure directly on the bleed in the case of a large artery like the carotid artery, or you would put a pressure between the bleed and the heart in order to stop blood from pumping towards the bleed, to limit as much blood loss as possible. So when we go through this list, we'll see that it's going to either be major arteries, so large arteries in the body, or they're going to be at junction points, like in where joints are, or in the upper arm or the upper leg, so that if you were to put pressure, you would prevent any blood flow distal to the pressure, which would potentially stop the bleed. So let's go through this list and kind of see. In the first, we got a couple here that are going to be for the head, so bleeds to the superficial skin and the superficial area of the head, and the temporal artery being one of those. So this isn't one of the correct answers that we're looking for, and the only reason is the temporal artery is a major artery in the lateral skull. So any type of cut or wound to the lateral skull, putting pressure here would help limit the loss. And number 2, jugular vein. Well, we're looking for arteries, even though the jugular vein is large. The question is not looking for veins, so we could cross that off. Facial artery, just like the temporal artery, is a major artery of the superficial cranium region. It's in the over top of the mandible, so any type of wound in this area, you put pressure here to help limit the amount of blood loss. So that is another one used for a bleed in the cranial area. Next, as we move through, we have carotid, where obviously carotid is a point. If we have a bleed or a wound to the carotid artery, we need to put pressure in order to stop that bleed, for just simply the amount of pressure and blood that goes through this artery. When you're putting pressure on a carotid artery, to only do it unilateral on one side to not prevent blood from getting to the brain. If you were to put complete pressure on both sides, you would prevent blood from getting to the brain, which obviously has its own side effects. Number 5 and 6, ulnar and radial, the distal arm or at the wrist area. These are not common pressure points, and the reason being because they're so far away from the heart, they are not common areas to put pressure. There's not as much pressure in these as some of the larger arteries, even though that they are, especially the radial, seen in suicide attempts where someone slits their wrists. The pressure would be above it, like in the brachial artery, to help prevent blood from getting to the wrist. The subclavian artery, which is kind of in the axillary region, any type of wound to the upper arm, you'd want to put pressure on the subclavian artery. Subclavian just means under the clavicle. And then we have the brachial, the largest artery in the upper arm, which is a common pressure point to help prevent blood from going distally to the arm for any type of bleeds below kind of the elbow area. And then finally femoral, for bleeds in the leg or the lower leg. The femoral artery would be the pressure point in order to stop that bleed. And then finally the popliteal artery, which is in behind the knee. It's a smaller artery and not commonly used as a pressure point because it's just the small amount of blood and pressure in it. So in terms of the correct response, we have is 1, 3, 4, 7, 8, and 9. So if we go down to the bottom, that correct answer being